Hello everybody, my name is Dr.Gershman and I'm the director of the Institute for Advanced Urology here at Cedars-Sinai Medical Towers. I'm also a clinical professor at UCLA. I'm here to talk about CaverStem procedure, which I have been performing since December of last year. Couple of things that I really need to share with you. One, there's very few options for treatment of erectile dysfunction that gives you permanent results. For example, the classical things like medications, Viagra, Cialis, Levitra, Staxin, all of them, gives you only temporary relief. Patients have to take the medication, wait for the results, and then it fades out, and every time they would want to perform, they would have to take a pill. The alternatives will be injections, which a lot of patients don't like to do because it relates to the needles and also painful sensation while you're injecting, or surgery, which is an invasive procedure, has great results, but it will require general anesthesia, hospitalization, etc., etc. So I think we've been looking for a different approach, in a sense, to treat erectile dysfunction. And with utilization of stem cells, I think we're very close to say that we have a permanent success. We started doing CaverStem, as I said, in December of last year with the notion that the bone marrow cells are the best sort of cells and origin cells to achieve these results because they are sort of the origin for all the mesenchymal cells and very potent cells. Also, there is a fairly easy way of extracting them from the iliac crest, which sort of gives the urologist a sort of a feel of fair simplicity of doing this procedure, short learning curve, and for the patients, minimal disfigurements and minimal complications. So with all this in mind, I think that bone marrow became sort of an ideal target for harvesting. There are other alternatives like PRPs, for example, when in the first stages we were using just peripheral blood draw and try to use thrombocytes to get the factors injected. But honestly, the clinical success of that was minimal, and I think it's more of a gimmick rather than an actual long-standing procedures that will sort of help to achieve permanent results. And then there are other cells like umbilical cord, fats, and going from one to the other, and I don't want to waste everybody's time giving you full lecture on different cells, but just using fat cells, in my view, is discouraging because it has inflammatory component in that and can create inflammatory reactions. And then we obviously trying to stay within one person. We don't want any autologous transplantation of cells from one person to the other or from embryo to the other, because that brings with itself all this gamut of potential complications and risks and liabilities. So we rejected that ideas and came eventually to the bone marrow harvest. Another thing that I think was really attractive to me as an academic urologist who just doesn't want to grab a procedure and immediately start applying it was the bulk of scientific data, and I think that CaverStem is one of those procedures that was studied extensively, not only on the animal models, but also in the clinical settings in Europe. Went through a lot of different algorithms of studies, including a recent UCLA study that was conducted on 35 patients here. So we're talking about a procedure that's not just a sort of a he say, she say, or something. It's a real deal, studied basically and with really robust results. In terms of my clinical experience of now close to 40 patients, we've tried different candidates and different types of patients to see how the implication of stem cells will change the pattern of their erectile dysfunction. For example, naive patients, younger patients, let's say between 30 and 40, with psychogenic impotence and organic impotence was one of the groups. Then the older patients that had BPH, organic changes, vascular changes, decreased blood flow was the second group of patients. The third, for example, radical prostatectomy patients who underwent cancer surgery and possibly had nerve damage and some partial erections. That was the other group, etc., etc. So we applied this technique to different groups, assuming that they would have a basic blood flow. So the prerequisite for the procedure was presence of some sort of partial erections, maybe not satisfactory for penetration, but at least partial erections, and also presence of blood supply. So all of the patients that we're doing undergoes consultation and some vascular studies to demonstrate that they do have blood inflow to the penis so we can work with. Because what the stem cells will do, they will help us to grow more blood vessels in the penis, in the corpora, help us to what we call vasculogenesis. And also it will help, based on the studies, to reduce corporal fibrosis, meaning make penis more elastic and more acceptable for blood flow. So with that, I have to report that we have, in my view, tremendous success. Now, you have to measure success. Everybody wants to have 100% success, but I tell my patients, if doctor tells you we're going to give you 100% success, even on a dental extraction, I think the doctor needs to be left, because there's no 100% in medicine. You know, there's always potential complications. So when I say to you that we have 75% clinical success rate, in my view, is terrific, because there's not a lot of alternatives out there, and 75% success, or even maybe more in the bigger studies once we gain more and more patients, would be a tremendous experience and tremendous success rate. And of course, while developing this procedure, we learned a lot. You know, how many stem cells we inject, what the volumes of and quantities of cells that we can apply, how we can create local ischemia in penis, creating all these kinin reactions that get acceptance to the stem cells in a better way. So as we moving forward, we're learning more and more how interestingly these stem cells work and what we can expect. And so far, it's been great. It's been great. The success and response from the patients are great, not only on the quality of the erections, mean hardness, but also on sensation levels. Some of them anecdotally reporting some changes in size, which I don't think we should even quote, but because it's just paradoxical, and I think it's more of a placebo effect. But we certainly seeing a tremendous response and reaction clinically on this patient. I think this is something here to stay and to develop, and I think we'll see more and more patients lining up to get this rather than taking medicine, and not only for the expense standpoint, because if you think about patient in 40s or 50s taking Cialis or Viagra for the rest of their lives, it's a tremendous expense, where this is a one-time procedure that can really cure them. The last thing I want to say, that as we say to the patient, it's a one-time procedure. Majority of my patients are warned right now that if they like the results and they want to have another injection, it's not discouraged. If anything, we encourage to inject as many stem cells as possible. So we're seeing more and more patients coming for a second injection, the third injections, because they want more and more appreciation of that improvement. And there's nothing that's contraindicated for us to inject more stem cells and develop more vasculature. So it's to be continued. Great success, great procedure. I can strongly recommend. Enjoy doing it very much, and thank you for taking time to listen to it.